Arganissima, New York. Your exotic skin, hair, and beauty source, and your one-stop shop for all your natural and organic skin and hair care, featuring authentic organic Moroccan oil and prickly pear seed oil and much more. Bringing you only the best, straight from the source and proudly produced in the USA. So what are you waiting for? Shop today at www.arganissima.com. Arganissima, New York. Your beauty is our...
Hello, folks, and welcome back to the iHealth channel, iHealth Radio. A new day, a new show with a provider, MD, someone that's going to take us through the tradition of family practice and really just primary care. So it is going to be a standard, show today with the real basics of healthcare, because again, we have different shows and we talk about different items, but really the concept of talking directly about what's important, which is our health and how to maintain it physically. It is important, but having a doctor that does that for specialty and a practice is important to get back to basics. So with me today I have Suryadutt Venkat. He is a primary care physician from Rhode Island, and he runs a practice, and he's going to talk to us a little bit about the concept of primary care in general, the importance of preventative care, the burnout, and a lot of the stuff that you as an audience and a listener and viewer right now can really benefit from. I do want to tell everyone that it's going to be a topic about your health and your family's health. So it's really I think it's a positive play to listen to and really absorb the information that we're going to get. So first things first, Doctor, welcome to the show. Welcome on the set, and thank you for the opportunity to be with us and the ability and willingness to share your insights and really the good stuff that we're going to share with our people right now.
Thank you for having me, Hurricane H. Yeah, it's exciting to be on this podcast.
Well, thank you. We have actually tried to do this, over the last few months, and with scheduling, it's been a little difficult. So I'm glad we made it.
And me too.
Yeah. Well, listen, we are here today, and we're gonna do it. But so the first question is, if you don't mind, give us a little bit of a background about you, your practice, your literally your story in terms of your history of how you got into the medicine, and why primary care specifically and not maybe some other specialty and things like that.
Sure. Hello, everyone. My name is Suryadutt Venkat. I'm a family physician with fellowship training in geriatric medicine. I've been practicing medicine for almost 20 years now. I've worked in many different roles. I've been in academics. I've served as an assistant professor at the Department of Family Medicine at the University of Massachusetts. I worked as a primary care physician and a geriatrician at a community health center in Fitchburg, Massachusetts. And I've also worked in a large group practice setting in the central Massachusetts area. Now I have my own private practice in Pawtucket, Rhode Island. So I've been doing this for a while, and really there are several things that inspired me to become a doctor. I've always wanted to be of service to others in a meaningful way and to make a positive impact in their lives. The idea of being part of a profession focused on serving others, regardless of their backgrounds and circumstances, focused on facilitating people to lead healthier and therefore happier lives is what truly appealed to me about becoming a doctor. And I love being a family physician. I like the variety in family medicine. I like the biopsychosocial and holistic approach to patient care. I enjoy taking care of patients of all ages, from newborns to elderly. In addition to diagnosing and treating acute illnesses, I like the fact that I can provide preventative care, routine checkups, health risk assessments, immunizations, talk about screening tests, and personalized counseling on maintaining a healthy lifestyle. Also love managing chronic diseases and coordinating care with other subspecialists. Basically, the goal of doing all of this is to help our patients effectively navigate a very complex healthcare system.
Wow. That's a it sounded like a small summary of a lot of the stuff that you do, and it is, but frankly it's a lot of stuff in there. In that particular minute you covered a lot of grounds, and I want to just kind of break it down a little bit. So first of all, family practice, I mean, you said it, it's from all ages, and which, by the way, for our audiences, and I think to clarify, it is not always the same to treat as someone that at a young age versus someone that is an older person, right? Or in
Right.
maybe an older I guess age bracket, right?
Mhm.
And so it, for you, it's a very, very diversified group that you have to handle. Different age groups come with different, I guess, diseases or illnesses, and so you maintain all that through your practice. And but when you started, I mean, I'm assuming it's all one. I mean, you're a family practitioner from the get-go.
Mhm.
And if you don't mind, can you just define the actual age group where it starts? I mean, pediatrics are part of that as well, or you have an age start point?
So the beauty of family medicine is that it allows the specialty focuses on holistic care for patients of all age groups.
Mm.
Unlike internal medicine or pediatrics, we're not truly restricted by age. So the youngest patient I see in the office is like a newborn patient that comes on like day 2 or day 3 after they're born from, like a hospital. They typically come to establish care with me, and they keep coming for their ongoing preventative exams. They see me for their physicals, they see me for their immunizations and so forth. And as they grow into kids and adolescents and adults, I see, like, I cover the whole spectrum, which is really the beauty of it. And so there's continuity of care, which is like crucial piece of family medicine, meaning I get to see them from the time they're born, until they become adults and elderly. If I'm alive, I get to see them, and I get to appreciate all the different milestones in their lives. And you're able to connect at a deeper level with patients, and they appreciate the continuity they get over years, which adds meaning to the medical care that they receive. Because if primary care is done right, patients really enjoy coming to the provider office and talking to them about not just their medical care, but also about other things as well. And that continuity is really what keeps it going and what keeps us going, which is really the beautiful component of family medicine. Unlike some other specialties which are restricted by age, pediatrics, some practices, they only go until like 18 or 21. Internal medicine, they focus mostly on adults, 21 and older. With family medicine, there's no age restriction as such. We see patients of all ages.
Well, thank you, Doc. And it's funny that you're talking about you seeing patients from the birth, and you go through their age groups. And in 20 years, I mean, I'm pretty sure you've seen a lot of folks grow healthy, and you help them stay there. And just, I wanted to just, if you don't mind, define for us the actual uh, primary care piece of it, because I
Sure.
know there's a lot to it. And I think, just to clarify for everybody, what is really the importance of primary care, from the beginning that you start with somebody, with a patient, to whatever, they for as long as they stay with you.
Sure. So primary care, in a nutshell, primary care is the provision of integrated, accessible healthcare services by physicians and their healthcare teams, who are accountable for addressing a large majority of personal healthcare needs, developing a sustained partnership with patients, and practicing in the context of families and communities. Okay, the care is patient-centered, team-based, community-aligned, and designed to achieve better health outcomes, and at the same time lower costs for the healthcare system. Okay, and primary care includes many different components such as health promotion, disease prevention, health maintenance, counseling, patient education, diagnosis and treatment of acute and chronic illnesses in a variety of healthcare settings. It's not just restricted to office, it's also inpatient, sometimes in critical care settings, long-term care, schools, and home care agencies and so forth. Okay. And primary care is performed and managed by typically a personal physician or a general practitioner like myself, who often collaborates with other health professionals and utilizes consultation or referral as appropriate. Okay. And primary care provides patient advocacy in the healthcare system to accomplish cost effective and equitable care by coordination of healthcare services. And primary care promotes effective communication with patients, which is very important. Okay. And not only with patients, but also with their families to encourage them to be a partner in healthcare. All right. So it's the patient's entry point into the healthcare system, and as the continuing focal point for all needed healthcare services going forward. All right. And primary care provide patients with ready access to their own personal physician and healthcare teams. It includes care that is person and family oriented, continuous, comprehensive, equitable, team-based, collaborative, integrated, and care that is of high value.
I have to say, that is the most defined definition, and clear
Was it too
definition.
complicated?
No, well, actually, it's funny because when you hear primary, you probably can think about a couple words, but the way you broke it down, it's a lot more of a multiple stages here and multiple activities going on in one in one concept, which is a great thing. That's exactly why I asked the question, because I think sometimes we don't understand the depth of what primary care is, and you just terrifically here give us a very, very comprehensive breakdown of it. And you're right. I mean, for me, I'm actually in the insurance space, so we're on the payer side. That on my regular job, and we're an HMO. I mean, I've been in the HMO world for 27 years, and so obviously we work with primary care doctors, as a core business, because really they're our backbone. And as an HMO, you have to have a primary care physician, that treats your patients, and in our case, our members. And one thing that we always really stress in discussions when we are talking to our potential prospects and members is really the importance of primary care physicians, the selection, and also the importance of preventative care with them, because it's all about preventative care. It's all about you having someone that is taking care of your health throughout your life and making sure that they understand all your needs. And sometimes people tend to probably don't go see a doctor until they're sick, and that's a practice that is completely wrong, as you know.
Right.
And that's really what we want to talk today about, the importance of not doing that, because a lot of folks may just like, I'm healthy, I'm good, I don't have to just see a doctor. Why do I need a doctor? When I'm sick, I'm gonna go to the ER. And actually that's what's been happening over the years, where people just wind up at the ER because it's a last minute things, and it just happens at night and usually on weekends. And then you get I don't know, it could be just a cold and someone wound up at the ER because they don't know what to do. And because they don't have a relationship with a doctor, it's a problem, because they don't even have someone to go to, or someone that's actually, they can pick up the phone and call. And so the idea of or introducing the primary care concept to someone is almost vital for you as a person, and everybody is watching and listening. You have to have the concept of having your doctor, someone that knows you, ideally from birth, if that's possible, but it doesn't matter any given age. You still need to, even if you haven't started, it's time for you to pick one and build a relationship, because you as a primary care doctor, you assess the health needs of that person at any given time, and then you determine a course of I guess action with them. So let's talk about that concept, the preventative versus the emergency, and that course of action, that things that you put in place to prevent someone from even winding up in some chronic disease, or winding up in the ER for that matter.
Right. So you hit the nail in the head. So preventative care is such an important component, and, it's very vital for all patients to have a good primary care teams in place, because really primary care providers or primary care practice in general, it's like quarterbacks, like in a football game, because they're coordinating everything for patients in the background. And really there's a lot of value-based care that happens with primary care that people don't appreciate as much. And a lot of them end up going to emergency rooms if they don't have primary care. and it's seeing doctor whoever who doesn't know anything about, their medical histories or underlying problems and so forth. So they cannot provide care in the context of what's happening, in their lives. And unfortunately, it's just a piecemeal approach, which is not cost effective in the long term. So in terms of defining preventative care, so preventative care is basically medical care that's provided to keep people healthy. The main focus is to keep people healthy and avoid or delay illnesses and effectively manage health conditions to prevent negative outcomes or to prevent complications, for patients in general. That's like the broad umbrella term, broad umbrella definition of preventative care. Now, in preventative care, there are many different aspects or components. Okay, so wellness visits, that's huge, or routine annual physical exams, that is something we really emphasize on. Then there's screening tests, depending on age, gender, there are certain screening tests that are recommended different stages in our lives. And I'll go over a little bit about screening tests. Immunizations, that's something we like to talk to our patients about when they come in for their annual physicals or even for their follow-up appointments. We emphasize the importance of immunization practices. And of course, counseling, no matter what the problem, we emphasize a lot on counseling. It could be something as simple as health promotion, tobacco cessation, adopting healthy behaviors, regular exercise and whatnot. Counseling plays a very important role to achieve better outcomes for patients in general. Now, when we talk about disease prevention, okay, there are four main components of, prevention. Primary prevention is basically intervening before disease occurs, before anything bad happens, proactively doing something to intervene or to prevent a disease or illness is what we call primary prevention, okay? I can give you some examples. For primary prevention, vaccinations, play a crucial role. We are vaccinating someone with the intention of preventing a disease, thereby preventing a negative outcome. So that's basically a classical example for primary prevention. All right, and altering risky behaviors. For example, counseling regarding tobacco or alcohol use or drug use to prevent a negative outcome, to prevent heart disease or hypertension that stems from tobacco use or alcohol use, that thereby we can prevent a negative outcome. So those are some classical examples for primary prevention, okay? So secondary prevention is basically screening to identify diseases in the earliest of stages before the disease progresses, before signs and symptoms of the disease starts, okay? Some examples I can give you are checking blood pressure readings on patients when they come in, diagnosing hypertension early on, starting them on treatment before the problem gets worse, or checking blood sugars, checking cholesterol numbers, when they come in, if they meet criteria for screening. Okay, and the intention is, of course, to identify the problem very early on and managing it effectively. Thereby, we can prevent, those problems from causing more signs or symptoms later on. Okay, then there's an entity called tertiary prevention. Tertiary prevention refers to managing diseases post-diagnosis. For example, if someone is already diagnosed with a condition, right? So we try to effectively manage the disease, thereby we prevent complications from that particular disease. And we can slow down the progression of the disease. That's the primary purpose of tertiary prevention. Some examples I can give you are, suppose someone suffers from a stroke, okay, and they have paralysis, say, they're not able to walk, right? So we can start them on physical therapy, occupational therapy. If they have any swallowing problems, we can put them on speech and swallow therapy, things like that. And the goal of doing that is to prevent more morbidity from the stroke or preventing complications from stroke and enabling them to be more functional in their own setups. All right, so that's a good example for tertiary prevention. Another one is, say, for example, you have a diabetic patient, right? You want to tightly control their blood sugar readings and tightly control diabetes so that we can prevent complications from diabetes, such as kidney disease, which we call nephropathy, or vision problems, which can happen from diabetic retinopathy, or we can prevent damage to the nerves, which we call neuropathy. So these are some examples for tertiary prevention. Basically, we're trying to prevent complications from the underlying disease process. And there's a relatively newer entity in prevention, which we call quaternary prevention, okay? So which is basically actions taken by providers to protect individuals, to protect patients from medical interventions that are likely to cause more harm than good. Okay, some examples I can give you are refraining from recommending medications that are not adequately assessed in large randomized trials, treatments that are not evidence-based, right? So if I recommend those kind of treatment options to patients, it's not backed by evidence, and I may end up doing more harm than good, by doing that, right? So obviously we want to provide good quality, good evidence-based medicine to patients. Thereby we can prevent negative outcomes. And steering patients in that direction, counseling them, educating them about evidence-based treatment options or guidelines is really one of the main responsibilities of primary care teams, okay? And I want to strongly emphasize on quaternary prevention, because that's our window of opportunity to do the right thing for patients and recommend treatments that work and that are evidence-based. All right. So in terms of, preventative care, a big component of preventative care is screening. Okay, screening, as most people know, is, trying to detect something early on, proactively, before something negative happens. All right. And there are many different types of screenings. We screen for cancers, we screen for high cholesterol, we screen for high blood pressure, we screen for vision problems in kids. We screen for osteoporosis, in elderly women. We screen for obesity. We screen for STDs in patients of certain age groups. We screen for coronary artery disease if patients meet certain criteria. When it comes to cancer screening, a lot of the screening recommendations, they come from, the ones we use in primary care. They're primarily from the United States Preventive Services Task Force, which we call USPSTF. They release guidelines, they publish guidelines, which are based on strength of evidence, based on large randomized trials, or, based on treatments that have been used so far, and, based on outcomes data. They take into consideration many different components before they publish these guidelines. And we follow them, when it comes to screening, say for breast cancer, or, cervical cancer, colorectal cancer, skin cancer, etc. Whatever type of cancer it may be, the guidelines actually are evidence-based, and, we follow them. And if done right, we can prevent negative outcomes. We can detect cancers early on before they start causing complications for patients, and we can improve outcomes for patients. We can, decrease mortality. We can decrease morbidity for patients. So it's meaningful, at the end of the day, for patients as well as providers, to cause good outcomes and thereby provide well-coordinated and cost-effective care for the whole system.
Well, doctor, thank you I was just literally immersed in all the breakdown of the categories here, and it's a lot of work that, when we just glance on the name of primary care or PCP or just a physician, we don't really look into it as deep as you broke it down right now. I mean, it's a lot of stuff that goes in, and for our audiences, I mean, this is exactly what we need to hear. Like, what would be the benefit from having your primary care, and what the things that we should be looking at to work with our primary care doctors for and about. And so it is important really to just take a deep breath here and just listen and just absorb all these functions that doctors will actually apply and do. One thing I wanted to ask for is, you mentioned the annual checkups or the wellness visits, which will be part of the assessments and at least the monitoring, right?
Right.
And so how frequently? I mean, I know there's different things that have to be assessed different times, and some require more frequency than others. What would you tell us about those?
So annual physical exams, when it comes to like wellness visits or physical exams in general, it is age specific. Okay. So for pediatric patients, the recommendations are slightly different depending on the age. Okay, and for elderly, it's typically annual. Now for kids, we like to see them, like I was telling you, we like to see them right after birth, like typically day 2 or 3 after birth. And then we like to see them at 1 month just to make sure they're gaining weight appropriately. And then we see them at 2 months, 4 months, and 6 months, and then 9 and 12 months, and 15, 18 months, and then at age 24 months, right? So after two, we see them at 2.5 and 3. Then after 3, it's typically once a year. Typically after 3 years of age, physical exams are typically done once a year. And there's a reason for that. We want to make sure they're gaining height and weight appropriately. They're meeting all of their developmental milestones. They're developing, the language skills are developing, their motor skills are developing, their sensory skills are developing. So we want to make sure they're meeting all of these, what we call developmental milestones, in an appropriate manner. And as they grow into like younger kids and adolescents, typically we see them once a year. We want to make sure that, again, the growth is happening, and it gives us an opportunity to screen for obesity. We counsel them regarding good practices, regular activity, good dietary habits, things like that. And then as they become adults, it's typically once a year. Okay. And during these annual physical exams, we not only talk about vaccinations, we talk about, health promotion, we counsel them, regarding healthy habits, and we order lab tests as appropriate, depending on the age. Okay. Sometimes we have to order screening for diabetes. We have to order cholesterol panels. We have to order blood sugars, to screen for diabetes. And, sometimes we have to check their lead or CBC to see if kids are getting exposed to lead, because that can affect their neurological development. Okay. And for, say, women 21 and older, they may need to undergo pap smears to screen for cervical cancer, right? And for patients who are 50 and older, now it's actually 45 and older, we have to talk about colorectal cancer screening. If they have any underlying family histories, the recommendations are somewhat different. Okay. And women 50 and older, we have to talk about mammograms to screen for breast cancers, right? And so there are all these different components of screening that we have to discuss, and it has to be tailored based on the age and underlying family histories and comorbidities of patients. So it can be quite complex, but it has to be tailored to the patient's age and underlying problems.
Thank you, doctor. And so just I want to link this to the next level, where the role of primary post hospitalization, for example, someone for whatever reason goes to the hospital and then they get discharged. The primary care doctor's role is a key at this point to do a set of things to help them, I guess, regain their regular life, or at least maintain whatever they need to maintain. What can you tell us about that?
Sure, that I'm glad you brought that point up, because it's a very important component of primary care. Doing follow-up visits after, say, they go to the emergency room, or if they get admitted and they are taken care of in the hospital and subsequently they get discharged. So there's a lot of care coordination that needs to happen from the primary care team. So first of all, we need to see what exactly was done in the ER, what imaging tests or lab tests were done in the ER, which means reviewing those medical records, when the patient is in the office or even before, is really important to come up with a good treatment plan for patients. Suppose they go to the ER and they come back to see me, or, they get admitted. Now we need to see who were some of the specialists involved with their care when they were admitted to a hospital, right? And what their recommendations were. For example, if I have a patient that gets admitted, say, for chest pain, and they're trying to rule out a heart attack, or if they have heart failure, they get admitted and they get treated in the hospital. So obviously I need to know what the cardiologist in the hospital recommended and what tests they did in the hospital. Did they do a stress test? Did they do any blood work? Did they do an EKG? And So what happened to the patient, ultimately, and what the recommendations were from the cardiologist, say for follow-up, and that I need to follow. And also requires coordinating with the cardiologist's office to make sure that all the nuts and bolts are in place. Like, does this patient have an appointment to see the cardiologist? Do they have an appointment for a stress test if it needs to be done as an outpatient? Things like that, and this is just an example. So a lot of care coordination happens behind the scenes that patients sometimes don't realize. So our office staff is calling, the specialist offices in the meantime and trying to get records from them. Or if it's electronic medical record, we try to integrate with the hospital systems and try to download information or data and discuss with patients. And also arranging for follow-ups is very important. It could be something as simple as a follow-up exam with me or with the specialist. Not everybody needs to follow up with the specialist after they get discharged. Say if they have an infection, if they have pneumonia, right? They get treated with antibiotics in the hospital. They get discharged, they come back to see me, and I see them, they're done with the treatment. If they're feeling better, pretty much that's the end of it. And we just want to make sure, and if it's a smoker, my job is to not only make sure they take the antibiotics as recommended for optimal treatment of pneumonia, it's also my job to counsel on smoking cessation. Thereby we want to prevent anything negative happening going forward. So things like that. So we do a little bit of counseling, we do care coordination. When they come in, we review their medication lists, because often when they get admitted to a hospital, the medications can be changed. They get started on different or new medications. So it's my job to do a thorough med reconciliation. I look at their med list and see if it matches with what they were taking previously or not. And it's my job to update our medication lists in our EMR systems. That way there's no confusion, because if somebody else, if a staff member is looking at their chart, we want to make sure that we have the right list of medications. That way there's no confusion across the board. And even if they go see a specialist in the same system, right? And if they access the same EMR system, so at least they will also know what medications this patient is on, because if they have to start a new medication, they have to look for any drug-drug interactions and so forth. So overall, it helps with care coordination if the primary care system functions optimally and does good care coordination with specialists as well as patients.
Thank you, Doctor, for clarifying. And that's pretty actually thorough and comprehensive explanation you've given us there. But I wanted to just touch base on something that relates to the same topic of care coordination, but now with health plans and insurers and managed care in general, because their mission, is typically, provide obviously the insurance and the cost payout, whatever for the care. But also there's a lot of work that gets done between the primaries and the care coordinator teams on health plans, on the health plan side. So I know there's a lot of work that gets done on that side as well, because ultimately the insurance companies, they do have, plans and programs for their patients or their members, and then they have to work with the primary care doctors to kind of coordinate some of these activities. Some plans have programs, for diabetes, for cancer treatments, for smoking cessation, and all this stuff. And also like post-discharge, things like that. So the same thing that we discussed, but now you have also a third party involved in that process. And the reason I'm asking this question, because I know that ties into earlier mentioned something about cost in healthcare and preventative, medicine does help, reduce the cost of healthcare in general. And now we're talking about costs and payout and payers and money and insurance. So let's talk about that component from as I know it's not easy, because I know there's a huge effort that goes between the two parties to actually make sure that the data is correct. Everybody has the information, it's available, it's properly coded and all the stuff, even claims wise, things like that, because also there's, for example, the government programs, there is all these things that, they're subsidized by the government. So they need to actually properly produce all the data, and some plans have stars ratings and things like that. So how do you kind of coordinate all that, with the health plans and the insurers, whether they're private insurers or government programs?
So the insurance part of it is also quite complex, just to keep it, simple for our listeners. There are many different types of, insurance plans that are offered, from Medicaid programs to Medicare to private payers, to whatnot. Like, the recommendations are different, the reimbursement rates are different, the requirements are different. It's quite complex, the whole world of insurance. And often prior authorizations are needed for certain tests and procedures that may be quite complex. And medications, just to get certain medications approved, we have to fill prior authorizations and fax to insurance companies to get the green signal from them to get a medication X or Y approved. There are many different moving parts to this. Now, when it comes to primary care, overall, there's a lot of emphasis right now on value-based models, value-based systems, where they're basically large, healthcare organizations that are operating, and, there are many smaller practices that are under like ACOs, we call them accountable care organizations, or, HMOs or whatnot. And the goal of having these models is to make care cost effective and evidence-based, and not only that, the ultimate goal is to provide better outcomes for patients. We want to make sure patients are healthy, and we prevent diseases from getting worse, or from complications from happening. Ultimately, it's a win-win for patients as well as providers to keep it cost effective and to promote positive outcomes. So there's a shift overall towards value-based systems, and value-based systems are basically where insurance companies closely collaborate with these ACOs or large healthcare systems, and they hold them accountable, for the quality of care that's provided. So it's basically how much money is spent on screening tests, what is spent on healthcare maintenance, lab tests, and so forth. Is it truly evidence-based? Was it truly necessary? Things like that. Those are some things that are looked under the microscope, and if it's a value-based system. And ultimately, the goal is to make sure that patients receive optimal care. Now, it is a broad topic, yeah, there's a lot of ground to cover with that. But just in a nutshell, we need to provide care that is evidence-based, that is cost-effective, with good care coordination, and avoid ordering unnecessary tests and procedures, that are not evidence-based, with the main focus of keeping patients healthy, to put it in simple language.
Oh, well, listen, that is the pure mission of preventative, as we said, and it starts with the patient and the people's health, and then obviously preventing them from getting any bad outcomes, as you said, as well as also saving the cost and reducing the cost. And I think you've covered a lot of that, because the fact is, if these people do exactly, the patients in general, and listeners, viewers, and all of us as consumers and just humans, if we were to really take this serious and take our preventative and primary care serious, I think we would actually probably have, a healthier, lifestyle, a healthier, and we're going to talk about lifestyles in a second, a healthier life with less complications. And if there are complications, we are able to mitigate them early on, or at least, prevent some of it to get, from getting worse. And so your role is really, really critical. I mean, it's as vital as it comes in everybody's life. And I think that's the emphasis that I want to, just as a message today, that, we want to focus on primary. That is your goal. Now, again, specialty care and all the other subspecialties are just as important, because people do tend to have different illnesses, and they do need these, extra, folks to help, with the care and treatment, with the coordination with primary care physicians and primary care teams. So again, I just wanted to thank you for, first of all, really breaking this down to the science that there is and the system as it is, and just clarifying, for our audiences. But also, like, again, for people, just know that this is something that you want to be aware of, and you should be, really involved in it. It's your care at the end of the day, or your loved ones. And so that is important. So you mentioned, doctor, something earlier about, we talked about briefly about drugs and hearings and things like that. There's always the question, that, well, there's not a question, there's this perception that when you go to doctors, typically there is medicine that is prescribed. Is that always necessary?
That's an excellent point. So not always do we need to prescribe a medication for a problem. Treatment is not always a pill for a problem. People need to understand that. The goal ultimately is to do what's evidence-based for patients and avoid causing any harm. That's one of the main things, we emphasize in medicine in general, be it preventative, be it primary care or specialty care. We want to do what's right for patients, what's evidence-based, and avoid ordering unnecessary tests and procedures and prescribing medications that are of no value or no, if they're truly not evidence-based, we should, steer patients in the direction of what's right and what's meaningful, for their medical care. Now, a lot of patients, when they come in, say, I can give you an example. If it's an obese patient, say with borderline high blood pressure reading, say it's pre-hypertension, we call it pre-hypertension, when their blood pressure is not high enough for us to call it high blood pressure, but if it's not normal at the same time, it's kind of in between, we call it pre-hypertension, right? So just by counseling them regarding good eating habits, regular exercise, cutting back on salt intake in their diet, we can, this is not necessarily a pill that I'm prescribing for this patient, it's just making these recommendations, counseling them about, good practices that itself can create a good positive outcome for the patient. They may lose a lot of weight and the blood pressure readings may normalize, and they may lose the weight and we can prevent heart disease. So that's our opportunity here, to cause a positive outcome. I can give you another example. Say if someone has slightly elevated blood sugar readings, or if they have like slightly elevated cholesterol numbers, so we don't necessarily need to treat them with a statin or with a diabetes medication in general, just by promoting, healthy eating habits and regular exercise, we can modify these particular problems, and we can treat their pre-diabetes or, pre-hypertension or slightly elevated cholesterol numbers, But of course, if you have someone with full-blown diabetes, or if they have like hypertension, obviously they need to be treated with the right medications with the intention of preventing complications and to reduce the risk for heart disease. And with screening tests as well, we want to capture those patients who may have like precancerous changes and act on it, that way we can prevent a cancer from happening. Or if they have a cancer, it's, by doing the necessary tests, we can identify the problem and prevent it from getting worse as time goes on by, referring them to the right specialists if need be. So bottom line is, it's not always a pill for a problem. The approach needs to be holistic. The approach needs to be based on their underlying comorbidities and problems and their lifestyles and their other habits. So focusing on those can, treat a lot of medical problems without necessarily having to take medications.
Thank you, doctor. And in the subject of medication, I know there's skeptics and some folks, sometimes they always, well, there's this whole potential perception that doctors push certain medications because of the relationship with pharma and things like that. If it's okay, if you have a good way to explain to people right now that that is not the case, and that the doctors have their own way of evaluating those medications and how they prescribe them to the patient, I think that can ease up a lot of minds.
Absolutely. I mean, I know that's the general notion, but trust me, we do get information from pharmaceutical companies, but we are not obligated to prescribe those medications. As physicians, it's our job to know which medications work for which problems, which medications are recommended based on scientific evidence, based on medical evidence. These medications, before they get released into the market, they are tested in large, what we call randomized clinical trials. These medications go through rigorous testing, on animals, and then, some small human populations, and large, human populations, and so forth. If it's deemed safe and effective based on data from all of those trials, that's when the FDA, will approve it, and it gets released into the market. And of course, it's our job to know what the adverse effects are and drug-drug interactions are, and what kind of negative things those medications can cause. So it's important to kind of stay up to date and know what new medications are in the pipeline and what kind of problems or benefits, that they cause. And it's really picking the right medication for our patients that provides the best outcome, and that's evidence-based, because we want to go by scientific data and not based on a pharmaceutical rep that is trying to push. So it's our responsibility, a collective responsibility as physicians to prescribe the right medications based on the evidence, and not just go by what a pharmaceutical rep is trying to convey here. So again, I want to reassure our listeners here that the approach is precisely that, and we are not, at least I can speak collectively for most of my primary care physician colleagues and specialty colleagues as well, that we want to do what's right for our patients and what's truly evidence-based, which is a big responsibility.
Well, it is. Well, again, I mean, at the end of the day, if there is any adverse reaction, I mean, it comes back to you. And then, it's, there's always the skeptics and the theories that, hey, we got to keep the patients, the people not as healthy, because then it's good for business. I mean, you have that extreme vision. There are some extreme thoughts out there that sometimes people can buy into. But
Right.
Our objective today is really to clear some of that. I mean, really, there is a noble picture here, and there is more to this than what people may think. And maybe there are odd cases here and there where that may be true, but that's not the general rule. And the general rule is that doctors are here to do the right thing and help people, again, prevent, keep them healthy and prevent them from getting any, illnesses and bad outcome in their health.
That's right.
So one very, I think, key question that I'd like to ask, and I know we have a couple, more, and we're running out of time, but if you don't mind, bear with me.
Sure.
So one is socioeconomics and their impact on access to care and primary care, specifically depending on where folks are and their backgrounds, communities, and things like that. That could be, and we hear this in the news all the time, equity in healthcare and access and so on and so forth. How does primary care kind of factor that in, and how does it work from your aspect?
So from a socioeconomic standpoint, primary care is all the more important, in my opinion, because, I've worked in a community health center in Fitchburg, Massachusetts. I worked in a FQHC, which is a federally qualified health center. I have taken care of patients who have had no insurance, or who are purely on Medicaid or state plans. So I've actually taken care of those patients, and I've seen the kind of positive impact, that it causes, good primary care systems can cause on patients, just by educating them. A lot of them may not have good health literacy, spending the time to educate them about good practices, changing their lifestyles, and coordinating their screening tests and whatnot. In the health centers, set up, they even have patient assistance programs that help. They have pay for patients who have transportation problems. They even provide some resources, they have some vouchers, and they had the vans that would bring patients in from, certain locations and whatnot. I see a lot of value, in doing that, because we're trying to promote communities and well-being in those communities, and preventing negative outcomes. And it has a ripple effect, just by, it's patients talk to them, patients talk to their family members, patients talk to their neighbors, and the word goes around. And, if they get the right message from their providers, they're more likely to say positive things to their neighbors and family members, and it has a ripple effect. And they try to seek medical care if they hear from their own, kith and kin, and that promotes more healthy behaviors. And I think overall, it's a win-win. And in my opinion, the primary care should be focused even more on, patients who come from lower socioeconomic backgrounds, because there's a lot of value in doing that, in my opinion. And just by improving health literacy and providing the resources that they need, we can decrease unnecessary emergency room visits, because oftentimes these communities, they may not have a lot of primary care providers in those areas, and they rely on urgent care sometimes, or they go straight to the emergency room to seek medical care. And that is not cost effective, really. I mean, an ER centric system is not cost effective, and it's ultimately, it's not going to be successful, because it's a recipe for burnout. And economically, it's not feasible, and it cannot be run successfully. So, again, emphasizing primary care, in those areas, can also keep people away from emergency room, unless they absolutely need to go to the ERs. And we can make the care more cost effective and meaningful for patients.
Well, doctor, you just alluded to my next question, and it's perfect segue, which is the burnout. So let's talk about that. What does that mean, burnout, in the context of preventative and healthcare?
So burnout is, it's huge. It's happening not only in primary care now, it's happening in other specialties as well. Burnout, in simple language, it's basically a long-term stress reaction that is marked by emotional exhaustion, depersonalization, and a lack of sense of personal accomplishment. And I can go over these components in more detail. So emotional exhaustion is basically a feeling of physical and emotional depletion. It's not just physical fatigue, it's also emotional fatigue that happens, with caregiving and trying to go above and beyond and trying to do the right thing for patients. Sometimes, it can be exhausting. The whole endeavor can be quite exhausting. And depersonalization refers to like having a distant feeling toward patients that may lead to cynicism or sarcasm, which is also described as compassion fatigue. And there's something called burnout. The other component is a low sense of personal accomplishment, which is basically a lack of efficacy or doubting the quality or meaning of your work as a physician. So like I was telling, burnout is happening not only in primary care, it's happening in a lot of high stress environments like emergency rooms. I mean, since the pandemic started, I'm sure all of us have had a better appreciation for our frontline workers, healthcare workers that are battling, the pandemic and the kind of stress they're going through on a day-to-day basis, with ERs getting flooded with patients and no hospital beds available in ICUs and, inpatient settings and whatnot. It's basically a recipe for burnout. In fact, the burnout rate has increased tremendously since the pandemic started, as most people appreciate now. Now, based on a 2019 online survey done on family physicians, nearly 46% of them reported at least one symptom of burnout, be it emotional exhaustion, depersonalization, or a low sense of personal accomplishment. So you can imagine how prevalent the problem is among healthcare providers. It's not just doctors, it's also other staff members involved, in primary care team and specialty teams, and also in hospitals. And I can imagine all those nurses trying to go above and beyond, since the pandemic started, and a lot of people are leaving. Unfortunately, they're leaving healthcare because of the significant stress involved, in taking care of these patients, which is sad. Our job is to recognize symptoms of burnout early on, and try to educate providers about ways of mitigating burnout, and helping them adopt, good strategies to better recognize burnout and take care of themselves. That way, they are able to develop more resiliency and get back into the healthcare workforce, and be available to patients in this time of critical need for everybody.
Wow. It is amazing, but you're right. I mean, the last few years, and it's been just known it's been taxing, and it is. I mean, we've seen it, we've heard it, we've watched it on the news, and I've seen it live. I mean, I actually live it daily on the insurance side, because even on our side we're experiencing it big time, and it is a fact, and I hope that people can realize that we need to do more to help kind of reduce this burnout business.
Absolutely. Yeah.
uh, so thank you for clarifying that. But so, doctor, one key element, you mentioned something about the pandemic and all the stuff, and also since we're talking on the topic of preventative and prevention, I know there's a hot topic of the hour, which is the vaccination against
Mhm.
COVID. And,
Right.
and what is the importance that that we need, that the message of importance that we would like to send to people? Because there's a lot of controversy about it, and there are pros and cons, and there are people pro it and against it and things like that. But what would be the message from a primary physician, that really promotes preventative care in terms of the vaccination and the impact of it, and how it's potentially helping people stay healthier and preventing severe disease from COVID?
So, as most of us appreciate, the pandemic has taken a huge toll on human lives, like not just in this country, but internationally. Globally, it has had a huge impact. The morbidity and mortality is something like unlike anything we've ever seen, in the past. And it takes a huge toll on everybody. It takes a toll on healthcare systems, it takes a toll on communities and families, and even at the individual level as well, with what we do, how we do things. We are focusing everything on what best we can do to put an end to this pandemic and provide better outcomes for patients. And the vaccines have played a crucial role in decreasing the spread of COVID-19 in communities. And it's based on evidence. It's based on scientific evidence. These vaccines have been tested in large randomized trials on kids and adults, and we have good quality, reliable data that has come out of these large randomized trials. So the evidence is there, and the vaccines, we've known about them: the Pfizer vaccine, the Moderna, and the J&J. They've all been tested on thousands of patients. It's not just like a few hundreds. They've been tested on thousands and thousands of patients in large randomized trials. And so far, the evidence is really excellent. That all these studies have shown that the vaccines are very, very effective in decreasing serious disease from COVID. Yes, they may not, prevent the infection itself. Does not mean that if someone gets the vaccine that they cannot catch the virus. Of course they can, but the vaccines are effective in preventing life-threatening or serious infection, from COVID-19, to the point that it requires them to be hospitalized and be in intensive care units or need oxygen and things like that. So our goal is to keep people in their communities and keep them functional and decrease the burden on healthcare systems by making sure they get vaccinated. That way, we decrease the stress on the healthcare systems, decrease the burden on hospitals and larger healthcare systems. Okay, and the vaccines have been shown to be very effective in doing that, because most people who are vaccinated, even if they get exposed to the virus, like I was saying, that they don't become seriously ill. They only have relatively milder symptoms, which get better within like a few days. It may feel like a common cold, and they're able to recover from it without necessarily developing complications that make them go to the hospital. That's ultimately the goal. And the more and more people we get vaccinated in communities, the sooner we can put an end to this pandemic. Ultimately, if say 75 to 80% of patients are vaccinated across communities, then the other 10 to 15% who cannot get vaccine for miscellaneous reasons, they will be better protected as well, because the transmission rates will go down in communities in general. And that is huge. And instead of depending on false information from social media and negative messages that are going, on social media, patients really need to look at what's scientifically recommended and the kind of evidence that comes from, large studies and reliable scientific sources. Patients really need to consider that. And I really want to promote vaccination practices, so based on FDA recommendations, patients of 5 and older, they qualify to get the boosters, and even, that they qualify for the Pfizer pediatric vaccine, and I really want to promote vaccination, because there's a lot of school-based transmission happening as well, and we're seeing a record number of pediatric hospitalizations now. It's our job and responsibility as medical providers to promote the message and encourage parents to get their children vaccinated and themselves vaccinated. If we can decrease school-based transmissions, we can make sure there's no disruption for education for our kids, and make sure they're able to have good and enriching academic experience in schools. And also for adults, we can keep them productive in the workforce.
Well, thank you, doctor. It's I love how you just.
I can go on and on about this.
Well, listen, this is you. This is what you do.
Yeah.
I'm enjoying it, and I know we come into the end of the show, but I just wanted to just touch just a comment rather on this vaccination piece. I think the issue is, you mentioned like the vaccination may not prevent you from getting the disease. I think that's a big thing that's been playing on the resistance, because we all think that when you get vaccinated, there is no more disease and you'll be done. Because again, we base it on history, on other vaccinations we've received when we were younger, right? And so I guess the model doesn't apply, and so that's where it loses the value. At least the trust factor on the vaccine is not there. I think also, to your point, there's so much negative or unscientific, and again, there's a debate about all that stuff on social media versus not social media, all these things. So there was also the history of how this whole progress from a pandemic of 2 weeks and they extended to 2 years. And so that, I think there's a lot of factors that affected it, whereby the people have, been divided because of that.
Right.
Because you're right. I mean, we know that most of the old vaccines, they were tested over the years, and we know the results because we all are here today. As you age, you've gone through at least a few bunch of vaccines when you're a kid, right? And this is like, we have the flu shots, and we have all the other ones that are seasonal, that have been in place for years. But I think there's two things: the introduction of the mRNA, the concept of a new type of vaccine. I think that was one, which is, for most people, they realize that it's a new thing, although it wasn't new. I mean, it's been in trials and testing in other type of situations. But I think that's one. And the other one is really just the fact that, because the messaging was kind of like off, and it wasn't clear from day one, and people are expecting, okay, well, we get the mask, we get the vaccine, this is gone. But then, and should be, the whole thing would be over with, but it wasn't. I think that's what caused more of the divide in the concept of vaccinations versus no vaccination. And I think people are getting closer to it now. They understand it better. They see the results more. And yes, there are more variants, but you're right. I mean, when you compare hospitalizations, vaccine versus no vaccine, there's a big difference, and there is. I've seen it personally in family where those that were vaccinated, and those that weren't, they had a milder, case versus the ones that weren't, and they really got impacted and got hospitalized. So I've seen it live, and I'm pretty sure. And again, people may be like, well, it's you think the way you think, that's okay. But again, at the end of the day, everybody's going to have to make their decisions. And this is not going to go away unless we all kind of, contribute to it. That's all.
Exactly. And that's really the ultimate goal. We can put an end to this if there's a concerted effort, if everybody pitches in and they do their fair share and they get vaccinated. and adopt healthy practices like good hand hygiene, mask wearing, avoiding congregations, and being mindful of situations. And yes, there's pandemic fatigue that has set in, but the virus is not fatigued. It's people that are getting tired of the virus, but the virus is not tired of what's going on, and it's propagating. So we should ultimately put an end to this by pitching in and doing what's right in the
Well,
broad
yeah,
scheme of things. Right.
thank you. Again, I mean, a lot of people are doing this and they're working towards it. There's a lot of effort out there. But again,
Mhm.
like I said, there's always the skeptics and there's always the different theories. Plus, it got a little bit of politicized over the last couple of
Yeah.
years because it started in the middle of a campaign. And
Right. Right.
so there's more to this than just, pure medicine. And there's also the pharma, there's also the profits, there's this, that. And so there's all kind of, and it's global and it just, some people question, well, how is this different from previous, pandemics or epidemics, whatever you call them? Because I mean,
Right.
again, it is COVID SARS, which was, a few years back, and it's a cousin of the MERS, and so they're the same kind of concept. So people are questioning like why then and why now not then, and what's so different. So these are the things that actually trouble people, and I think that's why the decisions are harder now. And then you have also the adverse reactions that have been reported into VARS, and I think that's the other part, and people don't talk about it. But from a statistic, when you compare those cases versus the millions of people who have received it and not have any issues, that's one. And then also some people are skeptical about, well, today we get it, but what's the outcome 5, 10 years from now? What's this thing's going to do to my body? And those are some of the things. And why is it only 6 months and we have to get a booster, and how many boosters are we going to get? So I think these are the questions that people still are playing with. And until
Right.
there's better clarity on these things, we will still have a divide. And I hope that eventually we'll get rid of all those questions and unanswered questions rather. And hopefully we come to an agreement that this is the best and the better thing for all the world. So
Absolutely. Yeah. The time will tell. We are still waiting for outcomes data, from all the people who have been vaccinated. And to your point, all those adverse effects that have been reported so far, they're being closely reviewed by FDA. And when we make recommendations to our patients, we try to educate them about all of the possible risk, or adverse effects that are associated with the vaccines, in addition to counseling them about the benefits of vaccination. So time will tell. We'll find out new things from ongoing data gathering process, from vaccinating people, and hopefully we'll achieve better outcomes for our communities.
thank you. I just wanted to just add
Mhm.
one more thing. I know there's a an unfortunate piece of information that may affect why people actually get the adverse reaction. And I think sometimes people don't tell everything. They don't tell the story when they go and get the shots. And so there are people who have had different shots, different things, medications, and other things that they may not have shared at the time of taking the shot or the vaccination. And therefore, it can contribute to an adverse reaction. So I think the message is really to be clear when you ask the right questions, answer the questions correctly to make sure that if it's not the right time, do not take the vaccination. If you have anything else that can, pretty much work adversely with it. And again, I'm not the clinician here, so
Right.
I'd like your opinion on that piece because I think like everything else, if the patient doesn't give you everything,
Mhm.
you will go based on whatever they tell you, and sometimes they may not give you the full picture,
Right.
and that goes right for the vaccination as well, I think.
Yeah, it's very important for patients to communicate with their providers about their allergy history.
Yes.
It's really critical to know what they're allergic to. Some people have histories of life-threatening allergies like anaphylaxis and angioedema, which are more, serious allergic reactions. So we definitely recommend caution, when we recommend COVID vaccines for those people. They need to receive the vaccine in supervised settings. Like if EpiPen is recommended for someone, basically the vaccine needs to be given in a supervised setting, and they should be observed for a good amount of time after they receive the vaccine to see if they develop any life-threatening allergic reaction. And if so, we should be prepared to give them EpiPen if needed or if indicated. things like that. And we need to know what underlying problems they have. Do they have any, immunocompromising conditions? Do they have any history of cancers? Are they taking any medications that can suppress their immune systems? Things like that. All of those things are things to be discussed, with providers. The patients need to understand that. And a lot of the adverse effects that we've come across, like be it injection site reactions like swelling, pain, fever, chills, flu-like symptoms, whatnot. So all of those typically happen due to an inflammatory process that happens in the body. After patients receive the vaccine, the immune system is put to work. And, when the immune cells are developing antibodies against other components, basically it can elicit an inflammatory response or an immune reaction, which is typically what causes most of these adverse effects that people experience. And vast majority of patients, it's relatively mild, and these symptoms usually get better on their own within 4 to 5 days. Sometimes it may go on for up to a week, but all of those symptoms are usually self-resolving, meaning they get better on their own. So that's something that listeners need to understand. And for some patients, yes, it may take a little longer to get better. And I've heard that patients reported having more adverse effects after they got the second dose, compared to the first, because the first dose is what we call a sensitizing dose. It kind of throw those components to the immune system, and the second dose is really what triggers those immune cells to make more and more antibodies. So when that happens, it can cause more of an immune reaction, and that in turn may cause more pronounced adverse effects. Even those are relatively self-resolving for a vast majority of patients, with simple supportive measures like drinking adequate fluids or taking Tylenol or Motrin as needed if they develop any body aches or fever, whatever the case may be, often helps take care of those adverse effects, and they get better on their own. It's really rare for patients to have, like life-threatening adverse effects. Like I said, people who have pre-existing allergies, if they've had anaphylactic reactions or life-threatening allergic reactions in the past, they need to be careful, before they can get the vaccine. Or if it's deemed not safe for them to get it, they should definitely discuss with their primary care providers or allergists, the case may be. And even, if patients have had an anaphylactic reaction in the past, does not mean they cannot get the vaccine. It just means that the vaccine should be administered in a supervised setting where there are capabilities to resuscitate them or give EpiPen, depending on what kind of reactions they develop.
Okay. Well, thank you, doctor, for I mean, the subject of immunization and COVID, we can talk about
Broad. It's
there's
really
there's
broad.
a lot there's a lot
Right.
to it. And
Right.
so, I mean, I know we've, your time is valuable, and I really took a little bit more of your chunk here, but so I just
My pleasure. Yeah.
no, thank you. I appreciate the time here and your patience. So I just want to just close the show with a quick question, which is about your services. I know you have your settings, local in Rhode Island, but now with telehealth and telemedicine, do you actually expand your services across and different states and different communities, or you still are within the same I guess community or the area that you service?
So we service in Rhode Island mainly, and our office is located in Pawtucket, Rhode Island. We provide full spectrum family medicine, full spectrum primary care, like what we discussed early on. We do offer telehealth visits, for patients who are not able to come in either because they got exposed to someone, or if it's a relatively simple, straightforward problem that they can discuss over the phone and get the help that they need. So we do offer telehealth appointments. We do video visits too sometimes. If someone has a rash, simple rash that they need to, discuss with the doctor, we do video visits. It's like a FaceTime call, but it's more HIPAA compliant and HIPAA secure platform that we use to make it safe and secure for patients. And, oftentimes that is helpful to diagnose a simple rash, but, if something's, not clearly visible on the phone because of resolution issues, we have them come into the office to be seen. But yeah, we service, mainly Rhode Island. We have some patients coming in from neighboring states too, like Massachusetts, mainly in Connecticut, but yeah, that's the population we take care of.
Well,
Basically.
there's a few million folks that are around the area, so they can all benefit from it. Again, the reason I asked is that I just want to extend that opportunity to, if you are open to other places, people can still reach out to you guys, and if not, I mean the local ones, we want to promote this and make sure that they know about the services and your contributions, and that you're there to help them, get healthier and stay healthier, and that's
I
it.
appreciate that. Thank you so much. I really appreciate it.
No, well, listen, it's my pleasure. And so, Doctor, thank you so much for your time. And I mean, you've given a lot of deep insights here, and probably clarified more about primary care than most people would possibly think. There was a lot more to it than the three letters in the acronym here.
It's my pleasure. Thank you so much for giving me a chance to come on your podcast and talk about these really important topics. And I feel like the listeners should understand what these different components are, and they should. I definitely encourage them to establish care with a good primary care physician. That way they get the right care that they need, and we can prevent negative outcomes for them. It's really the ultimate goal for all of this, and I really thank you for giving me a chance to spread this message to your audience.
Well, listen, this message is going to go literally worldwide. I mean, it's not just local, but I mean, there are a few folks that are watching these, internationally and stuff. And I think that the message and the information is valuable across the globe, because just is the same for everywhere. It doesn't matter if you're human and you care about your health. Preventative care should be your main thing. And I think now we've taught people what that means, and hopefully they can seek a similar, provider close by, and get the right outcome. And maybe we can prevent people from not going to ERs, and really just live a happy life. That's it.
Right. Absolutely. Yeah.
Well, Doctor, thank you so much for being with us. Folks, thank
My
you.
pleasure.
You're welcome. So folks, thank you for watching and listening on a health radio here. And, we'll just be talking soon. Different guests, different show, different topic. Ciao for now. Bye-bye.
Bye-bye. Yeah.